morning. My name is Teresa Millis, and I am your PTAP 125 instructor. And this is Brent McKay. He's one of the faculty in the PTA program, and his son is helping us behind the camera. His name is Noah. So this morning I'm just going to run through how to do a manual muscle test, and I usually start with the biceps when you guys come for labs, because the biceps is one of the more commonly known muscles and fairly easy to test. So I want you to learn biceps before we move forward to the scapular muscles and on down the arm. So the first thing you're going to do is you're going to do an introduction, and this is going to carry on through the entire program. So I want you to get into stating your introduction before you do a treatment. So I will introduce myself. Good morning, Brent. My name is Teresa Millis. I'm a physical therapist, and I'm going to be treating you today.
Hello.
Hi. So do I have consent to treat?
Yes, yeah.
Okay, so you do ask for consent to treat, or the patient may sign a form at the front desk. So what we're going to be doing this morning, Brent, is testing the strength of your biceps. And so I'll be asking you to do a certain amount of things and just do your best at doing them. One other thing I want to mention is we look at body mechanics, your body mechanics, and maintaining safety for yourself. I know that most of you, or if not all of you, do not have a high-low table in your home. But when I ask you to send me a video, just showing me a return demonstration, do your best to use your legs and not your back. Try not to do huge bendovers, and we'll work more on body mechanics when you come to class. So, Brent, the first thing I'm going to do is just see how much motion your elbow has. Okay. So as we know, biceps have flex the elbow. So this is the main thing that we're testing. So it looks like Brent has full range of motion. So now I'm going to ask Brent if he can do that motion. So Brent, can you do that same thing?
Yes, I can.
And Brent has shown that he can do full range of motion against gravity, which is considered a 3 or a fair manual muscle testing grade. So now we're going to march our way up the scale, which is how you're going to learn manual muscle testing in the lab and per your video that you'll be sending to me. So Brent, this time I'm going to have you do this motion, and I want you to hold it.
Okay.
And I'm going to give you some resistance.
Okay.
All right, so Brent can do the full range. So now I'm going to apply resistance. So remember, you have a stabilizing arm that will not move and help stabilize his arm. And then you have a moving arm, which is your resisting arm. So Brent, I want you to hold and not let me move your arm.
Okay.
Okay, ready. And hold, 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 and relax. So Brent gave me a 5 out of 5 manual muscle test for his biceps. It's pretty strong. So the differences between 3+, 4, and 5, I will demonstrate shortly and then discuss that a little bit more. So now a 4 would be a little weaker than a 5. So I asked Brent to come up and again stabilize and move. I want you to hold, hold, hold. And as you saw, Brent broke a little bit, but he was able to hold through the rest of the range. You're going to do resistance anywhere between 3 and 5 seconds. And now we're going to do, that was a 4 out of 5, now we're going to do 3+ out of 5. So Brent, I want you to flex your shoulder, or flex your elbow. And again, stabilize and move. Hold, 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 hold. And Brent is giving me resistance all the way through the range, but I can break him all the way to 0 degrees of elbow extension. That gives us a 3+. So when you do apply resistance, and usually this is a question in labs, part of it is you have to practice it to understand what kind of resistance you're applying, which is what I want you to do at home. But when you have a Brent in front of you who is fairly strong, and you have your 80-year-old grandma in front of you who may not have that kind of strength, you want to adjust your resistance according to the patient that's in front of you. All right, so I'm going to have Brent do one more motion in this, and I'm going to have you go through full range. So now, when you see a patient be able to do this movement where they are a 3 out of 5, you want to make sure that they're really a 3 out of 5. So now I'm going to give Brent resistance, and the way I know he's a 3 out of 5 is he won't give me any resistance when I bring him down. So Brent, I want you to hold, 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 and he just drops. So I feel no resistance at 3 out of 5. I feel some minimal resistance at 3+ out of 5. All right, now we're going to go down the scale from 3. We're going to go move into 3- and 2+. So now Brent is still in against gravity. And so when I ask Brent to do this motion, Brent comes, this is about 50% of full. Brent comes a little bit past 50, but not quite to 100. That is a 3-. And now we ask Brent to do that same motion again. And now Brent comes not quite to 50% of full range of motion. So he kind of picks the hand up just a little bit. That gives us a 2+. And at this point, this is when I might go into a gravity eliminated position to make sure that he's really a 2+ versus a 2. And it is at 2+ and 3- that you may see some substitution. So some things the patient might do in elbow flexion is roll over into pronation because they're trying to overhelp with their pronators, or they might start rolling in, trying to kind of help that elbow flexion with their internal rotators. All right, Brent, I'm going to have you scoot next to the high-low table, and we're going to now go put Brent into gravity eliminated. Okay, so now we're in the gravity eliminated position, and we're going to get the high-low table up to about 90 degrees of shoulder abduction, and his elbow will be extended out with the thumb up. So we have a pillowcase underneath his arm to help eliminate friction between the table and his arm. So now Brent, I'm gonna do the same thing I did against gravity. We're just gonna passively assess Brent's full range of motion, and it looks like he has full range. Now Brent, can you do that motion for me? And he gives me a 2 out of 5, or a 4 out of 5. And now Brent, I'm going to have you do this motion again, and Brent will show us a 2-. So this is considered a 2-, if he can just move a little bit out of full elbow extension. If he can move close to elbow flexion, but not quite, get to 100%, it's still considered a 2-. And now, and through all of these, you will be palpating the muscle. Here we're going to palpate for trace and 0. So trace is basically getting a muscle contraction without any kind of movement of the arm. So I'm going to be palpating on the biceps, and Brent is going to give me a little bit of a muscle contraction but no movement. That's considered trace, or 1 out of 5. And then again, with 0 out of 5, we're not going to feel any kind of muscle contraction, and we're not going to get any kind of action. So Brent, can you try and help me with that movement again? And Brent tries to give me something, and again, this is where you might see substitution, and he is not giving me anything at the biceps. So in summing up, there's also an altered scale that many of you have sent me questions about. Just remember, with the altered scale, there is no 2+, there is no 3-, there is no 2-. And with the altered scale, there is no gravity eliminated position. And this is primarily in your scapular muscles. So that's where you want to remember that altered scale with, I believe, 3. And review that in REES.